back to the show. On another episode of CoI'Q with Dr. Roxie, I have Matt, our producer, with us today instead of a guest, and he is going to have a conversation with me today, and we're going to talk about death by pilot, a phenomenon that seems to happen very often.
Yeah, and this is super fascinating. So let's start with defining the terms death by pilot, because I'm assuming this is not a reference to air crashes. What is the listening audience knows that you're talking about pilot programs. What do you mean by death by pilot?
Yeah. So I use this phrase. I have talked to so many healthcare innovators. And when I say death by pilot, what I mean is this phenomenon where health innovators end up having to launch a pilot in order to establish the medical validation or clinical evidence that they need for their innovation. And they get stuck in one pilot after another, and their business ends up going under before they ever generate enough clinical evidence to start generating sales. And I like to say that, I feel so bad for these health innovators because I say that they're stuck in pilot purgatory, and it's a thing. It's really, it's a real thing that I think a lot of health innovators can relate to.
Well, let's start at the kind of the root of the problem. So that they get the initial opportunity, they're super excited. Let's walk through that a little bit. What are some of the initial mistakes right out of the gate? Some of the things they don't nail down, the agreements, the pitfalls, things like that when you first get that pilot.
Yeah, sure. So when I'm talking to these health innovators, they get so excited. They're like, yeah, and I got this pilot. And they're just thinking that, it's going to be a home run now that they've got this pilot. And then they end up having this, rude awakening. And there's a couple of things that they either don't do or they could do to make that a better situation and get a better outcome from that. So when they're negotiating this pilot agreement, just because they're so excited that I finally got someone that's interested in my innovation, the whole negotiation process is just kind of like, yes, 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 to the hospital, to the health plan, whatever your terms are, let's do it, because I just want you to say yes, so I can go down the street and say, oh, I'm doing a pilot with John Hopkins, or I'm doing a pilot with, Florida Hospital, and forget that through that pilot agreement, I need to do certain things. I need to make sure that in that contract language that we're measuring certain KPIs, whatever those indicators are, to establish that clinical evidence. I need to make sure that I get access to the data and make sure that that's part of the agreement, because, if we have a pilot, but I don't have the data to prove it, then it was really worthless, right?
So did the pilot ever actually happen?
Yeah, exactly. And then the third thing is, again, it seems like it would be obvious, but a lot of people miss this, is some type of terms that if X, Y, and Z happen, then that's going to lead to sales.
Yeah.
Because the pilot is really supposed to be just the pathway to demonstrating safety and efficacy, and I need sales. And so too many times I hear that the health innovators will have a pilot with a hospital system or a health plan. Everything goes smooth. They couldn't have asked for a better pilot scenario. Patients are getting better, or they're actually adopting, the mobile app, or, the widget, and but then it doesn't lead to sales. And so, it becomes an illusion, or the innovator becomes delusioned that just because they have a pilot, that's going to be on the path to success. And really, if you don't negotiate any sales terms at the end, you can really be left holding the bag. And a lot of innovators end up going under before they actually generate any revenue, because they get stuck in this pilot purgatory.
Yeah, and how, when you say stuck in it, because we gave the example of just how maybe one specific pilot can go, it just doesn't produce the results that you want. It could go well without producing sales. But what do you mean by pilot purgatory? Are we going from one pilot to the next? Are we getting stuck in one really bad pilot with bad negotiated terms? What are we talking about?
Right. Yeah. So I'll give you a scenario. So I was talking to a couple of different innovators, and this is kind of what typically happens. I'm sure our audience will be able to relate to this. So again, I'm a health innovator. I go out to a health system. Everybody's really excited. We ink the deal for the pilot, and I'm excited about it. The pilot is underway. And so now I'm negotiating terms with another hospital system in the same area. So let's just say, for example, ORMC, Orlando Regional Medical, was the first hospital. So now I'm pitching Florida Hospital and, to adopt the innovation. And they say, oh, well, we need to do a pilot. And I'm thinking, I'm so glad you asked for this, because I actually just did a pilot with ORMC in the same market.
Mhm.
And I'm going to, share that clinical evidence with you. And they go, no, 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 no. Our patient population is different. Can you believe this? Our patient population is different. And you're like, no, but both hospital systems are in the same city. And they're like, yeah, but we have a different patient population. So in order for us to adopt your innovation or even consider rolling it out, we've got to do a pilot here too. And so
Ugh.
it becomes pilot after pilot after pilot, and you run out of money before you ever actually start generating in sales. And so it's a real problem. And so that's why I say stuck in pilot purgatory, because it's one pilot after another. And,
Mhm.
health innovators, I hear this over and over, is when am I going to actually get to the end of this where it's going to
Mhm.
be enough clinical evidence to actually start generating revenue?
Yeah, man, that's interesting. So let's talk. We talked a little bit in a previous episode, which everybody should go check out, just about the difference between launch and commercialization. We talked a little bit about who are you speaking to, right? Are you speaking to the mainstream? Are you speaking to the early adoption? And so, kind of your solution to this is really part of your whole strategy of going to the early adopters first. So let me ask you this: when you do a pilot, how important is it to understand the person that you're dealing with and whether they're a part of the mainstream or whether they're a part of that early adopter? Because it seems like that would drive a lot of the outcome of the pilot and whether it actually leads to sales.
Absolutely. I mean, I think that sometimes, these health innovators just spinning their wheels if
Mm,
they are looking to do a pilot with a hospital system or a health plan that is really part of the mainstream market, and they're not one of the early adopters. So, I would say that you want to be able to get pilots with those early adopters, because those are the ones that are going to be more likely to buy at the end of the pilot, instead of
mhm,
just doing a pilot and going, yeah, that was great.
mhm. And how common is it? What type? Tell me a little bit about this scenario where you can walk into a pilot and come out with an agreement that if this pilot does what you say it will do, and everything looks good and it comes out the way that we expect it to, that we will buy at the end of this pilot. What is that? What does the scenario look like? What is the company? How is the company positioned? How is the innovation positioned? Put you in that kind of a negotiating position.
I think that you have to, identify one, what is the patient population that's even viable for this? And, what is the percentage of the patient population that's participating in the pilot? Do you have enough people participating to be able to extend those results, or have those results validate the entire patient population? Because I think another thing that you don't want to get involved in is, I did a pilot, but we did a pilot with 50 patients, and now they're still unsure on whether those results are going to apply to the 10,000 patients. So I
Mm,
think making sure that you've got the right sample size is going to be really important for negotiating that.
mm.
um, and
Okay.
just having some early dialogue early on in the process of, how likely are you to buy, and let's put that in writing. Let's put that in the agreement, that if A, B, and C happen, then you are going to buy, and be specific. And I think health innovators are like, they just struggle with having that negotiation power, because all the power really is with the health system or the hospital system.
Mhm.
And 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 so I might acquiesce, or I might negotiate to less than favorable terms, because I just want to be able to say that I have this pilot going on. But if it really doesn't amount to anything revenue wise at the end of the day, then it really is just a waste of time.
Mhm. That's interesting. Yeah, it all deals with limiting beliefs and personal development and all kinds of fun stuff. But it is interesting. I think there's when you talk about negotiation and getting the best, most favorable terms for a pilot before you even start, there are some negotiating tactic things that you've talked about that have been very helpful. But the flip side of that is that hopefully, if they've been working with you through that process and they're being guided through an early adoption strategy with your help, to me, what that does is it helps position them differently so that the negotiating conversation changes. It's qualitatively different, right? It's not just a matter of, well, I could have massaged that a little bit differently. I could have said some things differently during the negotiation. To me, when your company is positioned well and you're coming in from a position of strength, it changes the quality of the negotiation. And I think that's part of what your goal is when you're working through this early adoption strategy, is to position them completely differently. So they're not in a weakened, kind of negotiating position where they're kind of at the mercy of these hospital systems and other types of people they're trying to sell to, and they have to acquiesce on all these terms.
Right, right. Yep. And it really goes back to what we were talking about in one of our previous episodes, like you had mentioned about the difference between launch and commercialization. So if you're just looking for a launch plan, you're not generally developing a pilot strategy or a pilot plan. It's a lot more ad hoc, and it's not part of that. Whereas, from our point of view, it's a very important and critical component of the early adoption strategy going forward, or that commercialization strategy, to make sure that you have market success.
Yeah. Love it. And I know we'll go into future episodes. We'll talk a little bit more about early adoption strategy. You'll talk to some founders that have walked through this successfully and can share their own experiences with going straight after the early adopters and why that's important. So definitely, for the folks that are listening, go check those other episodes out. What's the best way to connect and just get into your world, learn a little bit more about the CoI'Q strategies and framework?
Sure. So you can go to drroxie.com and check out our show website, or you can go to legacy-dna.com and get more information about the commercialization services that we offer.
Perfect. Roxie, fantastic. I really enjoyed the conversation. I know people on the listening end got a ton of value from it, because I'm sure you're describing exactly what they're going through, and gave some great tips to solve it. So thank you so much.
Thank you. Bye-bye.